Begin with the presentation, and then we will provide time for questions and answers. We'll ask you to continue to mute yourself and ask your questions through the chat that I will then read. Thank you to those of you who sent many questions in advance. That has helped shape the presentation that you're about to hear. So without further ado, I would love to introduce our speakers. We're very thankful that we are joined this afternoon by two of our most progressive, inclusive, and open doctors. Dr. Meb Rashid, Medical Director of the Crossroads Clinic at Women's College Hospital and Assistant Professor at the University of Toronto, and Dr. Isaac Bogosh, Associate Professor at the University of Toronto, and also a doctor at Toronto General Hospital. Welcome, Meb and Isaac. The floor is yours.
Thank you so much, Debbie, and thank you to everyone for taking the time to be with us today. And we're hoping to address some of the questions that we're hearing in the community about the COVID vaccine. I want to start by drawing your attention to an article you might have seen in the Toronto Star a couple of weeks ago. And it was an article that was documenting the uptake of the COVID vaccine amongst residents of long-term care here in Toronto, and public long-term care institutions here in Toronto. And quite impressively, there was over 90% of the residents who took up the COVID vaccine. But when we looked at staff, close to 60%, 57% of staff decided not to take up the vaccine. And to me, this is a huge issue. Now, we all know that working in long-term care, predominantly, we're talking about people who are working low wages. It's often precarious work. It's often part-time work. And we know that there is an overabundance of newcomers, newly arrived immigrants and refugees who are working in that sector. And what we were hearing about in long-term care is identical to what we're hearing from our patients at the Crossroads Clinic. We've got a clinic that serves newly arrived refugees, often in their first couple of months and in Canada. And we were hearing the same sort of reticence about the vaccine. So why the reluctance? It's made us take a step back. Well, one, I think of course, it's important to recognize how individual communities have been marginalized by the healthcare system. And I know this has been a historical issue, but I would argue even around the pandemic. We know that there's a greater proportion of newcomers and racialized communities are affected by COVID. We know PPE came late. The PSW is working in long-term care. We know that testing was limited in areas of high burden. So, trust only comes with trustworthiness. And I think for us in the healthcare system, it's something to recognize when we look at the decreased uptakes in racialized communities, we do need to contextualize it with that lens. The other thing, of course, that we're finding is that a lot of our patients are getting information over the internet. And some of that information is really dubious, but it seems to have stuck. Every conversation I have with the patient right now, every assessment, I follow it up with a question about how their feelings about the vaccine. And it's been disappointing. I think there's been a lot of misinformation that has stuck and that's being spread in those communities. And so I think for those of us that work with newcomers, it's critical that we provide this information. Now, what people do with it is their business, but I think it's really important that people have accurate scientific information. I would also argue, for settlement workers, people working in the community, you probably have some of the greatest impacts on the people you're serving. More than Toronto Public Health websites or stuff that's on the Ministry of Health website, we know a lot of people are getting their information from people we trust. Hopefully that's healthcare workers, but it's also, very much settlement workers and hairdressers and friends and family. So it really is important for all of us to keep up and keep informed and make sure we disseminate this information. Okay, so today we're going to talk about some of the questions we're hearing from our patients when we speak to them. How do the vaccines work? How effective are the vaccines? What are the side effects? What do we do with these vaccines in special populations? People are immunocompromised or have autoimmune disorders. One question we're asked about quite frequently is how are the vaccines produced so quickly? And we're going to spend a little bit of time talking about that process.
Ma'am, I'm sorry, I need to interrupt you, but is it possible for you to be a bit louder? Folks are having problems here.
I can try. Let me just see.
That would be very helpful.
Is that any better?
I think sound is good. Some people is not having it because of their problem, I think.
Okay, thank you.
Good. Yeah.
Okay, thank you.
I will try to speak up. All right, so other things we want to cover is allergies, what to do after you get the vaccine. Do we, do we still need to wear a mask and distance? and then we're going to speak a little bit about the current rollout and eligibility for the vaccines. Many of you must know Dr. Bogosh, who's become a TV celebrity, as well as really one of the most important voices around the vaccine and the rollout. So I'm going to run through the talk, and Isaac's going to chime in whenever he has things to add, and then we promise you'll get a chance to ask him a number of questions. So, okay, so let's jump right in. Now, this is really a little bit more complicated than I wanted it to be, but I want to give you an idea of how the two vaccines that are currently available in Canada actually work. All the vaccines that come out for COVID will have one thing in common. They are going to deal with something called the spike protein. Now, what is the spike protein? The spike protein, as you might be able to see here, is this little thing that covers the virus itself, right? What we're doing with vaccines is we're teaching the body how to recognize that spike protein. So if we're ever confronted with the virus, the body will recognize it, the immune system will kick in, and it'll fight off that virus and prevent you from getting sick. With these two vaccines that are marketed right now, the Pfizer BioNTech vaccine and the Moderna vaccine, they work in a similar way. They take a compound called mRNA. It's in the vaccine. It's injected into with the vaccine, and it's taken up by cells. It goes inside the cells, and basically the mRNA is instructions for the cells on how to produce the protein. So you'll see then the cells themselves will produce the protein. That creates this immune response. And basically the immune system is primed. So if it ever sees the virus, it will know to attack it by attacking that spike protein. So that's how these two particular vaccines work. We're expecting other vaccines in the pipeline to work a little bit differently, but they'll all focus on that spike protein, which is on the virus itself. Okay, so let's look at these two particular vaccines that are available to us, the Pfizer BioNTech vaccine and the Moderna vaccine. And you'll realize that they've come to market based on two very large studies. Each of them had a very large study that looked at their effectiveness. So the Pfizer BioNTech vaccine involved 43,000 patients, the Moderna vaccine 30,000 patients, mostly in adults, Pfizer over 16, Moderna over 18. With both vaccines, there were 2 doses separated by 21 days for Pfizer and 28 days for Moderna, and they followed people for at least 8 weeks, right? And what did they find? Well, the way it works with both those studies is they give half the people the vaccine, the other half get an injection with another substance. They follow people and they look at the number of cases of COVID in those 2 groups. They found that in the groups that actually got the vaccine, they were 95% less likely to get sick with COVID, right? 95%. I mean, that far exceeded anyone's expectations of the vaccine. There was talk from experts before saying we would be thrilled if there was a vaccine that was 50% effective. So 95% effective. And the other thing that was really important in these studies is when we looked at severe illness, right? People who ended up being hospitalized. In the Moderna study, there was 30 people with severe illness. All of them were in the placebo group. So none of the people who got the vaccine got incredibly ill. And it was the same with Pfizer. It was a very, very small number of people who actually ended up with severe illness. So are the vaccines effective? Highly effective, at least in the studies that have been produced. Okay, the other question we're asked is, what are the side effects? Well, in many ways, the side effects of the vaccine are very similar to what we see with other vaccines. Many of you get the flu shot. The flu shot causes low-grade fever, headache, fatigue, nausea. The most common side effect is pain and swelling or muscle aches in the arm in which you got the vaccine, right? With the COVID vaccine, it's very similar, right? So when we look at the numbers, the common side effects are pain in the arm, headache, muscle or joint pain, fever, chills, swelling or tenderness under the arm. And then we'll see some redness and swelling, less commonly nausea and vomiting, and uncommonly enlarged lymph nodes, right? The majority of these side effects will happen after that second dose. The numbers are a little bit higher in the COVID vaccine than other vaccines, but nevertheless, still quite rare, and all of them will resolve within 1 or 3 days, all right? Very serious allergic reactions are quite rare. Okay, so another question we get asked is, what about people who have weakened immune systems, either from illnesses or from medications? The study didn't include people who were immunocompromised, but I think most physicians, most healthcare workers, when they look at how the vaccine works, feel that it really shouldn't be an issue in almost all circumstances. So the advice we're giving to people is certainly discuss this with your specialist, make sure they're okay with it. But most of the experts we've spoken to feel like there's very few immunocompromising conditions that will prevent you from getting the vaccine. The other thing that's important to remember is that if you are immunocompromised, there's some data out there suggesting you're more likely to get very sick from COVID, right, than someone who doesn't have those conditions. So, again, people who are on things like steroids or prednisone, people who have medical conditions that are immunocompromising, check in with your physician, but it really shouldn't be an issue. The other thing is autoimmune disorders. Now, there's some literature out there that suggests for some other conditions that if people are vaccinated or if they end up getting ill, that it might trigger their autoimmune disorders. There's absolutely no evidence for this with the COVID vaccine itself. I think most people, when they look at how these two vaccines are working, don't feel this will be a big issue. But again, if people have multiple sclerosis, other autoimmune disorders, it's something to check in with your specialist about. But in the vast majority of cases, your doctor will tell you to get the vaccine and that there shouldn't be any increased side effects from it. All right. What about pregnancy and breastfeeding? So again, as with almost all trials out there, it's very difficult to incorporate pregnant women within trials, right? So there wasn't a lot of data from the Pfizer and the Moderna studies we were talking about before. What is interesting, though, is both those studies, sometimes people, although they're advised not to, things happen and people get pregnant. And so there's a small number of cases, I think it was 13 in the Moderna trial, a few more in the Pfizer trial, where women did get pregnant after they got the vaccine. There were a few miscarriages, but they were all in the placebo group, right? So very small numbers, but somewhat reassuring. The group that oversees obstetricians and gynecologists in Canada, so the leading authority advising doctors who deal with pregnant women, say that the vaccine should be offered. We know enough about how the vaccine works. We know that pregnant women can be at increased risk of more serious side effects. Again, this is the type of issue you should discuss with your physician, but almost all physicians are going to tell you that it is safer to get the vaccine than to not get the vaccine. All right, so something to think about. And a lot of this is based on the fact that we know how the mRNA vaccine works, right? And given its the mechanism in which it works, it's unlikely to pose a significant risk. More studies are underway, and we'll talk a little bit about the data that's driving this. Okay, another question that we're getting asked is, should I get the vaccine if I already had COVID, right? Am I not protected? And the answer is absolutely yes, right? Even if you've had COVID in the past, we're not sure how long your antibodies will last. We are recommending at this point that everyone gets it. And just as a bit of a tangent, even if you've had COVID in the past, you still need to take precautions, right? So we hear stories from some of our patients who've had COVID and feel they can interact with others. We're still asking them to keep a mask on, to socially distance themselves and take precautions. Because you've had it doesn't necessarily mean, there's been very few case studies, but doesn't necessarily mean you won't contract it again. So at this point, that is the advice we're given. And certainly for the vaccine, when it's your turn to get it, even if you've had COVID in the past, you should receive it. Okay, I'm going to spend a little bit more time talking about the licensing process because we hear this very frequently. The vaccines were produced very quickly. Were there steps missed in the process that makes the vaccines less safe? So this is it's a really dry slide. Bear along with me. I'm going to take you through this. But this is from Health Canada, and it's the process in which vaccines are developed and licensed here in Canada. So you'll see that scientists develop a potential vaccine. They conduct lab and animal studies before testing on humans. And when we get to human trials, there's really three phases. There's the first phase where you look at whether the vaccine's safe, what's a safe dose, are there any side effects? And if it looks like it is safe and there aren't serious side effects, you move on to a larger phase 2 trial that looks at how well the vaccine works. You look at dosing, you look at is it safe on a larger number of people. And then finally, the phase 3 trials, which are the ones we were looking at with Moderna and Pfizer, where there was tens of thousands of people. And those phase 3 trials really give us the evidence on does the vaccine prevent disease and what are the side effects of the trial. Only after the phase 3 trials, you would submit the information to Health Canada for review, and then they would take a look at that information. What was different with these two vaccines? Well, one, you remember, if we go back now, 12, 13 months ago, that very quickly after COVID was recognized, the genetic sequence was developed by China. They actually sequenced the virus and shared that information. So researchers all over the world were ready to go. They had that material. The other thing about this mRNA technology is that it's been utilized for many, many years. So people have been looking at it in terms of cancer treatments. People have been looking at it for some vaccines. So as soon as we knew what the sequence was, it was fairly straightforward to incorporate it into the concept of a vaccine. The other issue, of course, is that when we look at the development of vaccines, people have to look at cost benefits. I mean, what are the costs for running these trials? How do you get the funding together to do this? With COVID, of course, this was a non-issue, right? That the funding rolled in, so that initial phase was really quite straightforward. The other thing, of course, is when we looked at the human trials, there were no shortage of volunteers. So it can take weeks to months to try to get enough people. These were very large trials. So when you're looking at 30 to 40,000 people, it can take quite a lot of time to get people to sign up to participate. It was not an issue. People are suggesting that it was almost immediate that you're able to get to those 30, 40,000 numbers. The other thing to remember when we talked about how these trials are done, remember half the people got placebo, the other half got the vaccine. And then you follow people for illness. Now, if the illness is not common, you have to follow people for much longer. Sadly, in a way, there was a lot of COVID in places where these trials were taking place. So it was relatively quick. It was relatively easy to see the differences in the two groups, to see the prevalence of disease in people who got the vaccine and see how different it was from the people who didn't. So that certainly helped. The other thing that I think was really important was something called a rolling review process. So you can imagine historically people would have their trials, they would write it up, they would submit it, it would sit on someone's desk, it'd be a weekend, people are on holidays, they would then send information back, responses would have to come. What happened in Canada and many places across the world was that there was a continuous sharing of information between Health Canada and the manufacturers of the vaccine. So questions were sent back and forth, right? Which saved a tremendous amount of time. So even once the vaccines are improved, you'll see that experts look at the evidence, Health Canada approves it. Only then will the government coordinate the purchase, logistics, and distribution of vaccines. That was not an issue with the COVID vaccine. As most of you have recognized, the vaccines were bought before they were licensed, right? Before they were even developed. So a lot of these processes were done simultaneously. It's not that the process didn't occur, but there were a number of reasons why this vaccine came to market very quickly. I think the take-home thing for many of us to share with our clients is that no steps were actually skipped in the vaccine testing or approvals process. Matter of fact, these tests, these trials for the COVID vaccine were 10 times larger than other vaccine trials in the past. The reason we got the vaccine so soon was because Health Canada received and reviewed data regularly. And also maybe important to know that many times with vaccines, drug companies will follow that vaccine as it sits in fridges to see how long it lasts. They didn't do that with these vaccines because I think all of us realizes as they come out, they're going to go into arms very, very quickly. The important thing is safety testing was not skipped in the development of this vaccine. I think that's something a lot of our patients are asking about. Okay, another thing we get asked is, can we get COVID-19 from the vaccine? Okay, we sort of answered that before when we talked about how the vaccine works. Remember that we cannot get COVID vaccine. The vaccine doesn't contain the live virus, right? So remember, when you're getting vaccinated, it's that mRNA, it's not the live virus. And that mRNA, what it does is it triggers the development of that spike protein, that protein that you'll see on the outside of the virus that's sort of in this picture here, right? It's a very important protein because it's this protein that allows the virus to latch onto cells. But the immune responses for that protein, the mRNA we're taking in does not produce the live virus. So you cannot get live virus. You cannot get the actual infection from the vaccine itself. Now, one thing that sometimes confuses people is that after the vaccine, it wouldn't be unusual, as we said before, to get some symptoms that look like COVID, muscle aches and fever. And I'll just remind people is that when you do get the vaccine, if you get those symptoms, it is still important to rule out COVID. Right? Remember, with the vaccine, it can take a week to 2 weeks, even after the second dose, to get full immunity. So, you might hear some stories of people who got the vaccine and then tested positive for COVID 2 days later. That's not a failure of the vaccine. There is a bit of a delay while your immune system kicks in for you to have full protection. The other thing I should mention as a bit of a tangent is, do you remember when we talked about how the vaccine works, and we inject that mRNA and it's picked up into the cells, and the cells then use the mRNA is taken up by the cells, and the machinery of the cell is used to produce the spike protein. I should mention that mRNA does not go into the nucleus of the cell. Okay. The reason I mention that is it's inside the nucleus of the cell where the DNA is. So that mRNA does not affect the DNA. It doesn't interfere with the DNA. It doesn't mix with the DNA. I know that's one question many people have asked about with these vaccines. With the mRNA vaccines, there is absolutely no impact in the DNA, okay? So we should be reassured about that. All right, was the vaccine tested on diverse populations? These numbers are from the study. So you can see this is that large Moderna study with 30,000 people. And this is the Pfizer study. So about 10% of people were Black or African American, about 5% were Asian. And you can see as you go down the list, this is wording from the study itself, so not my wording. And what was very reassuring is that when we looked at each of these subgroups, there was no evidence to show that there was any difference in how people were responding based on differences in these populations. So it seemed to work as well in all these subgroups. I should also mention 28% of people in the Pfizer study were self-described as Latin American. So they sort of, some would have been in the white category, some in the other category. So a fairly good representation from many diverse groups. All right. What's in the Pfizer vaccine? When we look, there's the mRNA, right? It's an mRNA vaccine. And then there's fats, salts, sugar, and water, okay? Nothing there that should be so striking for the biochemists in the audience. Here's a list of the fats, here's a list of the salts, here's the sugar. I'll draw your attention to this polyethylene glycol. We're gonna talk about that a little bit more. Same thing with the Moderna vaccine. It's an mRNA vaccine, so there is the mRNA, which is the medicinal ingredient. And then the non-medicinal ingredient, there's fats, salts, acid stabilizers, sugar, and water. And again, if you want to get into details of it, this is it. And again, you'll see this thing called polyethylene glycol. And I draw your attention to polyethylene glycol. We often refer to it as PEG, because when you look at what's in these vaccines, it's really the only thing that's known to cause allergic reactions, right? And what is it? Well, polyethylene glycol you can buy over the counter. It's actually in laxatives. And for those of you who might have had bowel procedures, it's often used to clean out the bowel as a treatment for constipation. It's also found in certain cosmetics. It's quite common out there, but there's been no cases of allergies to polyethylene glycol in cosmetics. It is found in things like extract Tylenol and Tylenol Easy tabs and gel caps and Benadryl, Laxaday, Go Lightly, Reactant, so Advil, liquid gels. So in specific types of over-the-counter medications. So many of us have taken some of those, so that's somewhat reassuring. It is a different preparation, but this is really the one thing that if you're allergic to, and I think very, very few people out there are known to be allergic to polyethylene glycol, that would make us pause before you give people the vaccine. What's not in the vaccine? No food products. So if you're allergic to nuts or strawberries or whatever else it is not a problem taking the COVID vaccine. There's no antibiotics in there. So if you've got a penicillin allergy, it's not a problem taking the COVID vaccine. There's no thimerosal. So, if you're worried about mercury, that's not an issue with this vaccine. There's no formaldehyde. And, there is some theory going around on the internet about microchips being injected. There are no microchips injected in this. There are lots of microchips on my cell phone to follow me, as I'm sure Apple does, but that is not an issue with this vaccine, all right? We can reassure people. What do we do for severe pre-existing allergy? So if, for example, I am known to have a very severe allergy to nuts, or to something else. I think as a precaution, what we're asking people to do is to wait 30 minutes after the vaccination. Everyone will wait 15 minutes after they're vaccinated. But if you have a severe allergy, it's worth sharing that and you stay a little bit longer. At all injection sites, right? Now, there are staff available, doctors and nurse practitioners who are trained to deal with anaphylaxis or severe allergies. Remember, almost all cases of anaphylaxis happen in the first 30 minutes after vaccination, right? And really, the only reason to be suspicious is if you're known to have a severe allergy or if you're known to have an allergy to a constituent of the vaccine. And that really would be that laxative we talked about, that polyethylene glycol. Okay, what happens after receiving the vaccination? Okay, people have asked, can we shed our mask? Can we hug the people we love? Unfortunately, not yet, right? You must still take precautions. Now, why? A couple of things. One, we're not sure if we can still carry the virus. We know that the vaccination prevents us from getting sick and certainly prevents us from getting serious illness, but we're not sure as yet if it prevents us from carrying the virus without us knowing it, right? And there's studies that will speak to that. And I think Isaac probably has more information on that. It's also important to remember that the vaccines are 95% effective. That means there is 5% that ended up getting the infections. They might not have been severe, but they did get symptoms of COVID. So it is really important to carry on wearing a mask, to socially distance, to wash your hands. Of course, all of us are expecting that as the vaccine rolls out in a big way, there'll be less COVID circulating and some of these precautions will ease. But that really is a reflection of how many people in our communities get the COVID vaccine, not on, we can't shed those precautions after we individually get the vaccine. And of course, again, a bit of a reminder, if you do get fever after the vaccine, you must still rule out COVID infection. Okay, do we really know about the side effects of the vaccine? Well, remember, as of a couple of days ago, nearly 91 million doses of vaccines have been provided worldwide. Now, these aren't all Pfizer or Moderna, but we are learning every day about these vaccines, right? There's never been a healthcare intervention that has had the kind of scrutiny, that has had the kind of oversight as these vaccine rollouts. You remember the first couple of days after the first few vaccines went out, anyone who fainted after a vaccine, and that happens, right? And it's happened in our clinic many times. It has nothing to do with the vaccine, but they were on the front page of the news, right? So there is a lot of oversight. The good news is, after these 91 million doses, we're not hearing a signal of really severe side effects of anything major that would be any different than one would expect with people getting vaccinations, right? So that's really good news. I wanted to just start the conversation about the provincial rollout plan. When we were looking at the questions many of you had, and I think this is a question that all of us have across Ontario is, when are people going to be able to access the vaccine? When can our families get it? When can, our grandparents or parents get it? When can our clients and patients get it? Well, the provincial government has rolled out, 3 phases to how this vaccine is going to be distributed. We're now in phase 1. So there's limited doses of the vaccine available, and really it's being directed towards long-term care homes, retirement homes, both to residents, but also to staff to work in those homes. To healthcare workers who are seeing patients, our colleagues in ICUs and shelter workers, people who work in the emergency rooms, people who are working with COVID programs, and then remote Indigenous communities. We're hoping as the stock of vaccines increases, which we're hoping will happen in the next couple of months, that the number of people who get access to the vaccine will be expanded. And we'll be able to include people who are at higher risk because of chronic conditions or age. And then phase 3 will happen when there's an abundance of vaccine, and we'll just be lining people up to get everyone vaccinated. So to summarize, and I hope this gives us a little bit of a background to start our conversation, both vaccines right now, both the Pfizer biotech and the Moderna vaccine, they've both been very well studied, right? We know newcomers are at high risk of COVID-19. They deserve to be well informed about the vaccine. I think the onus really falls on us as being the folks who are working with newcomer populations to make sure we're as well informed as we can be, but to make sure that we're also sharing this information with newcomers who, in many ways, a lot of us are concerned are getting some misinformation that's disseminated to them. And I truly believe that you are in the primary position to have some resonance with the people you're seeing. You know, settlement workers, community workers. You know, this is where newcomers go. This is where some of their strongest relationships are. You are some of the most trusted people out there, and it really, you know, you're going to be tremendously important in making sure that this messaging gets to newcomers, right? So that's all I had for you, which hopefully has given us a lot of time to have a discussion.
Thank you, Meb. Yes.
So I'm trying to talk fast.
You kept us glued to the screen.
I'm trying to talk fast because I know everyone has questions for Isaac. I always have questions for Isaac. So,
that was great.
So Isaac, are you ready for the first question?
Yeah. But also, first of all, Meb, that was wonderful. Thank you so much. I'm sitting here learning a lot, and it's great. It's great to hear. Wonderful job. That was great. I
thought that was a great job too. So there, you know, the audience was just going crazy with questions. So I'm going to pick and choose, paying attention. And Meb, there are lots of, you can read it yourself from the chat. So the first question, Isaac, it's around people with chronic disease, especially things like diabetes, you know, asthma, folks who are allergic to penicillin. What are you saying to these people?
Yeah, so I agree completely with what Meb said. Remember, the vaccines that we have right now, the Moderna and the Pfizer vaccine, it's not like those are going to cause harm in these individuals. It's that these individuals may not have the same response to the vaccine. But these are individuals who are at risk of severe illness because of their medical conditions. So most physicians are recommending that they get vaccinated because they're at risk of having a bad outcome. So most of us are recommending vaccination to these individuals.
Is that also true for women who are pregnant? I know Meb covered this, but there's a question, what's the danger to the fetus?
So it's very important that we know three things here. One, pregnant women and people who are breastfeeding were not included in the clinical trials. Two, it's very, very unlikely that anything is going to happen. You never say never, but it's very, very unlikely that anything's going to happen with these vaccines in people who are pregnant and people who are breastfeeding. And currently they are being enrolled in studies to evaluate the safety. But three, it's not our business to make decisions over women's bodies. People can make informed decisions for themselves. We know pregnant women are at greater risk of having a severe infection if they get COVID-19. It's a pandemic and there's a ton of infection out there. Who are we to say you can or cannot have this vaccine? So this is the time for pregnant women to have an informed conversation with a healthcare provider to determine if they want this or not. I'm not trying to push anyone in any direction, but most of them that at least I've been in touch with have been choosing to get the vaccine. Most people who are pregnant or breastfeeding are choosing to have the vaccine, but you can make the choice. It's not paternalistic medicine where we choose for you.
Will the vaccine change your DNA?
No, easy one. It does not. It has nothing to do with your DNA. It doesn't change your DNA.
And just something related, why the use of mRNA in this vaccine and not DNA as usually is the case?
So this is brilliant because there's a few reasons. Number one, this vaccine technology has been around in development for decades. It's just the first time it's actually been used on a mass scale. Number two, it's way easier to make vaccines using this technology. So for example, when we make the flu vaccine every year, it takes a long time to actually make that type of vaccine. With the mRNA vaccines, you can make a ton of vaccine in a short period of time. And the third reason is if you need to adjust the vaccines, hey, every year like the flu vaccine, you have to adjust it. Maybe you have to do it with COVID-19. You can adjust it so much easier and mass produce it so much easier. So this is brilliant technology that was about to explode anyways, and we just happen to have a pandemic and get to harness it here. But as Dr. Rashid said earlier, you know, they went through the right phases of clinical trials. They went through the right safety precautions. There were no corners cut. Dr. Rashid, you know, covered that, and you know, he's right.
Yeah, the question actually, and Juliet, I was actually just going to ask that very same question. What happens if you don't get the second dose? Moderna is saying within 28 days, for example.
So it's okay to delay that second dose by a while, but you don't want to delay it too far. So first of all, the first point is the vaccines that we currently have in Canada are 2-dose vaccines. You should get a second dose. The second point is if you get 1 dose, you start to actually have some protection at about 12 days or so after the first dose, but you get maximum protection with that second dose. The third point is that you can delay that second dose, just don't delay it beyond 42 days. Okay, but if you think about any other vaccine that we have that's a multiple dose vaccine, when in the history of planet Earth has anyone got that second dose or third dose exactly at that time frame? Zero. It never happens. So, you know, if you just get that dose within that the second dose within that 42-day time frame, you're going to be completely okay. The third thing is we're in a time where there's a lot of new information coming out quickly. This might change with time. That's okay. If the policy changes, as long as it changes based on data, we're fine. So that's what we have now. Everyone gets 2 doses. 1 dose is good. 2 doses is better. Get that second dose within 42 days. That's what's happening everywhere in Ontario, regardless of what you want. And this might change with time.
There's another question about what if someone has cancer or and is undergoing treatment? It's what's your saying there? Is that the same thing? Check with your doctor?
You can check with your doctor, but I got to tell you, like, just behind the scenes, people with so infectious diseases specialists who specialize, subspecialize in infectious diseases of people with cancer, on chemotherapy, and with organ transplants. That's like the immunocompromised subspecialty of infectious diseases. We're strongly advocating to give this vaccine to their patients earlier on. So the subspecialists who know everything about this, that's not me, are really pushing to get access to the vaccine for their patients. Have a conversation with your doc, and you make a decision for yourself. I'm just saying that many docs are really pushing for this in their patients because those people are at risk of having severe illness.
Folks are wondering, with the new variants, will this vaccine be effective? Do you know? What's the thinking?
So, you know, it's the classic medicine answer. It depends. And it depends on the variant. There's the variant that was discovered in the United Kingdom. All the data to date tells us that the vaccines will work against that variant. Then there's the variant that was discovered in South Africa and the variant that was discovered in Brazil. Those are the 3 biggies that we're talking about. There's probably more. Well, there's definitely more out there. The vaccines on the variant discovered in South Africa and the vaccine on the variant discovered in Brazil have less efficacy. They don't work as well against those, but they still work. That's the key point. They still work. They just don't work as well. Here's the other important point. What matters? Like when you think about a vaccine, what matters? Well, those vaccines, even on those variants where it doesn't work as well, still prevented people getting really, really sick, prevented hospitalization, and prevented death. The number of times people were hospitalized or died who received the vaccine in those areas where those variants existed was 0. 0 hospitalizations, 0 deaths. So number one, it'll still protect you from COVID-19. It just doesn't protect you as well. Number 2, if you're unlucky enough to get COVID-19, it will significantly reduce the risk of hospitalization or death. Kind of important things that you want to prevent. So, you know, we're still saying like these vaccines are going to work. Now, it also tells us that we'll probably need to update this vaccine, and many of the companies are working on updated vaccines, even while the current vaccines are rolling out.
Very good. Well, what's the immunity? Is it for life or 1 year, 6 months?
Unknown, totally unknown. Probably going to be months to years, but you know, we might need a booster, we might need an update, and this is an issue that's going to be studied with time and resolved with time.
Okay, trying to organize.
Debbie, I like how we have this cadence here. It's like
I know, isn't that great? Another medical question. I just lost it. Therapeutics. Given the interruption in the manufacturing of the vaccine, what's the role of therapeutics?
Therapeutics are okay. I mean, you know, in all fairness, the drugs that we have to treat COVID-19 are really most beneficial for when people are unfortunately sick enough to be in hospital and require supplemental oxygen. We give a lot of a drug called dexamethasone. It's a pretty powerful steroid. It works pretty well. But in terms of therapeutics for people that are infected but not sick enough to come into hospital, there's been a million trials, and unfortunately, we just don't have anything that really works all that well Yes, people talk about hydroxychloroquine. Yes, people talk about ivermectin. Yes, people talk about colchicine. Yes, people talk about vitamin XYZ and blah, blah, blah. Nothing really stands up in the clinical trials when it's studied empirically, despite what you read on Facebook. And, you know, I think we should really, obviously we have to be open-minded. Obviously the data can change, but currently the best drugs to date are the ones that are mainly used in hospital settings. So that's a very good question, because that's still a very active area of research and a significant area we can improve on.
Before I go to some other specific questions, if everyone, and I think this is a question about herd immunity, if everyone gets the vaccination who wants it, how long will it be before we return to what this person is calling, normal?
Yeah, so what you're going to see over the course of 2021, here's a prediction. Okay, you can laugh me off this call, I might be wrong, but you know, anytime you have these long-term predictions, you have to sort of say, like, you know, all the caveats, timestamp this, blah, 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 blah. I might be way off. The next 8 months are going to stink. Or sorry, let me rewind that. The next 8 weeks are going to stink, not 8 months, right? It's winter. We have very slow vaccine rollout. All the vaccine rollout is really focused on the highest of high priority, which is, as many people on the call know, those who live and work in long-term care. Well, when we get more vaccine, we'll be able to expand it to other healthcare providers and people in the community, et cetera, et cetera. We're not expected to really ramp up vaccine delivery until late March or early April. That's why the next 8 weeks are going to be tough, because we're still going to vaccinate, it's just slowly. When we enter the spring, we will be able to vaccinate much more broadly. You're going to see this out in family physicians' offices and community centers and mass vaccine sites and pharmacies on the corner and mobile trucks to vaccinate whole indigenous populations that are underhoused or other underhoused populations. It's going to be big and it's going to be good. Throughout the spring, as more and more people get vaccinated and as the weather actually improves and there's fewer indoor contacts, you're going to watch cases go like this. You're going to watch hospitalization go like this. You're going to watch deaths go like this. We probably need about 70, maybe 75% of Canadians vaccinated to achieve herd immunity. As we get through the spring, as more and more of us get vaccinated, as cases go down, as 2021 moves on and on, you're going to see a gradual lifting of these measures. You know, more people allowed in indoor settings, more people allowed in outdoor settings, more indoor dining, less travel restrictions. It's just going to happen throughout the year, slowly, but it's going to happen.
Another health question. If someone has had COVID, should they take the vaccination? And can you get COVID twice?
So yes and yes. If you get COVID, you can get COVID twice. The data that we have to date suggests that the risk starts to go up a bit after 3 months, but really picks up after 5 months after people have recovered from this infection. Of course, that's not a hard date, but you know, you start to see more credible cases of reinfection about 5 months after people have recovered. That's why if people have recovered from COVID, you should still get vaccinated. You don't need to get vaccinated right away, but you know, a couple months after recovery, if the vaccine is offered to you, great idea to take it.
Given the new variants and a lot of news coming out of the border south of us, should people now be wearing double masking?
Oh, awesome question and very timely. Anthony Fauci was talking about this about, I don't know, 2 weeks ago, and the media just ate it up. Ah, double mask, everyone double mask. What they didn't see was, I don't know, a couple of days ago, he gave an interview and someone's like, really? Double masks? He's like, what are you talking about? Like, no, like there's no data for double masks. He's basically saying, make the mask fit. First of all, wear a mask. Step one, if you're in an indoor setting, put on a mask. Like, let's just focus on that for the most part. Okay. Number two, now that we all have masks on, let's wear them correctly over our mouth and nose. We're not neck maskers. We're not chin maskers. Wear it properly. Number three, okay, we now are wearing masks in indoors. We're wearing it properly. Let's at least use decent quality masks, which are, if you go on the Public Health Agency of Canada's website and type in masks, it will give you good details about what a quality mask is. 3 layers, little filter in there, or I've got 100 of them right here. I'm sitting on the Toronto General Hospital 14th floor, surgical mask, whatever. They all work fine. They're fine. Now, don't come at me with guns blazing, 3 weeks, 5 months, I don't know, some time from now saying, you said this on this date. Life changes, data changes, science changes, and guess what? Policy might be updated later on. This is what we know today. This is what works today. Let's focus on today.
There's another question about anaphylaxis. I'm never sure if that's how you pronounce that word. But I think this is a news story that came out of the UK when the vaccination was first rolled out, that folks, I believe it was a nurse who got severely ill. And so the person was wanting to square the circle, because you're saying it's safe for those folks to take it, and yet this has happened.
Yeah, so a couple of points. Dr. Rashid was talking about the risk of a severe allergic reaction with this vaccine, and he listed off all the ingredients, which was one ingredient that's usually the culprit allergy, that's that PEG, and then the other ingredients was basically what constitutes my diet for the last 9 months, which is salt, fat, and sugar and water. But basically, that was a joke, vaccine joke. You never really know when you're talking on Zoom. Are people laughing? Are they not? Like, you have no idea.
You're laughing. It's okay. It landed.
Can't tell. Could have bombed. Anyways, I saw Mev laughing. That's what matters. So basically, the PEG, if you've got an allergy to that, you can't take these vaccines. It's plain and simple. If people have severe allergies, you can talk to your allergist about it. But let's look at data. There is great data emerging from the United States. Right now, they're vaccinating about 1.5 million people per day now. They cut the data when they had about 1.8 million vaccines administered. And in 1.8 million people, they had less than 20 of these severe allergic reactions. And fewer of them constituted anaphylaxis. If it's going to happen, it happens usually within the first 15 minutes after the vaccine. So that's why you sit around for 15 minutes after your vaccine. And there's healthcare professionals on site that have EpiPens, if God forbid you need an EpiPen. So the take-home points are, number one, this is an extremely rare event. Number two, if it happens, it's an extremely rare event. Number two, it's even rare for people with allergies. Okay. Number three, if it happens very early on after vaccination. And number four, if in the very, very, very rare event that it happens, you're in the right place for this to happen, because they are set up to care for people if it happens on a rare event.
Okay, in the last 9 minutes, let's turn to the politics of the vaccine.
Oh, my favorite topic.
Will the vaccine be free and available to everyone, regardless of immigration status?
If you are in the country of Canada and you are eligible for the vaccine, you can get the vaccine free of charge. Full stop. Doesn't matter who you are. If you're in our country, meaning our collective, our country, you can get the vaccine.
Yes, and I actually posed that question last week to the Minister of Immigration, and he basically said the same thing and referenced their participation as co-chairs of COVAX to prove that they were big on equity. So they would of course practice it here at home as well. So that was actually reassuring. What about seniors? The focus has been on long-term care and hospitals and congregate settings. What about seniors who are living in their homes? Often we know, especially with immigrant families, there are usually multi-generational families in the home. There isn't a lot of space. What's the thinking about seniors who are outside of this long-term care homes, for example?
I'm glad you asked that, because quite frankly, with so little vaccines, you have to prioritize. Who are you going to prioritize first? You have to go where the fire's hottest. Those who live and those who work in long-term care. Full stop. You look at the deaths in Canada, it's long-term care. You got to protect long-term care. The deaths in Canada are like 70 to 80% in long-term care. It's a no-brainer to focus on long-term care. Then we can start expanding outwards. Yes, you got it. You also have, we're in a situation where we had possible precarious workforce. Like, if you can't staff your hospitals because everyone's getting sick with COVID, you're screwed. So that's why some, not all, but some frontline healthcare providers were vaccinated as well. When you look at the plans, for example, the Ontario plans for rolling out, stage 1 overlaps with stage 2. You don't finish stage 1 and then move to stage 2, they overlap. And the overlap of stage 2 at the very tippy top of stage 2 is seniors in the community seniors. It's going to start with those over the age of 80, and it's going to move down in 5-year increments, over 80, over 75, over 70, over 65. There's others who are going to be prioritized in that group as well. For example, you might be out of that age category, but have a medical condition that's, precludes you to severe illness, predisposes you to severe illness, you'd be prioritized there as well. But so short answer, yes, seniors are prioritized. And when vaccination programs start to ramp up, get ready, because it's coming.
We know that kids were not included in the studies. So how young is too young for the vaccine?
So currently in Canada, you can give it to 16-year-olds and up. The two big companies, Moderna and AstraZeneca, have now enrolled or enrolling children as young as 12 in their vaccine studies. Those data should be available probably by the summer. Other vaccine companies are enrolling kids as well. So, knock on wood, when it's time to go back to school in September, a huge chunk of the children should be vaccinated by then, hopefully.
Very good. There are questions around allergies again, but I think you said, depending on the allergies, it should be safe. If not, check, if you're concerned, check with your health professional. People are saying this is an amazing session. When will Canada start producing its own vaccine?
Huh. Can I brag for a second?
Yes.
I was literally right before this, I was an invited guest to speak at a federal parliamentary subcommittee on health. And that was my final point. You've got to invest in local scientists and local industry to be self-sufficient for vaccination. It is a health security issue. It's an obvious point. And there is some capacity in the country, but not enough, So I think this pandemic is a big wake-up call for a lot of things, including self-sufficient personal protective equipment as well. Many people on the call will very much relate to that. I remember walking into the hospital in the first wave and it's like, here's your mask for the day and that's all you got. I'm thinking, thanks, So yeah, we'll get there, but not for this pandemic, for the next one. And
the last question, how is Canada ensuring its ethical and moral responsibility to ensuring that COVID vaccines are made available globally?
So we participate in something called the COVAX program, which is a global consortium led by the WHO and another big program called Gavi, the Global Alliance for Vaccination and Immunization, where we donate money and vaccines to really ensure that low-income countries and low-middle-income countries have access to vaccination. How's it going so far? Terrible, thank you for asking. So on the one hand, they've collected gazillions of dollars and have tons of commitment for vaccinations. But on the other hand, when you just look at the final pathway, needles going in arms is painfully slow. It's gonna happen, but this is a major equity issue and a justice issue. And the world cares, at least they care on paper, but talk is cheap. Let's see needles going in arms. I'm going to brag again for a second. I was advocating on the BBC, but really, because the UK has a ton more access to vaccine than we have. And I was saying, once you've vaccinated, you're vulnerable and you're elderly and you're vulnerable and you're looking into, your 20-something-year-old healthy crowd, maybe that's the time or even before then to start donating blank % of your vaccines that you actually have to other places. Now, the UK was heavily impacted. It's one of the most heavily impacted countries on the planet. You shouldn't detract from their epidemic. But on the other hand, once you've protected your vulnerable or more protect your vulnerable, it's certainly time to look outside and help others. And I really hope Canada does the same.
Yeah, I'm glad you said that because I think that was one of the concerns. And I don't remember who from government basically said that we ordered all of these vaccines so we'll be able to share, but we will only share after all Canadians have been vaccinated. And I think that have raised red flags. I'm not sure that I don't recall who it was. So I hope it wasn't our PM, but it could have been. I may have misspoke. But certainly is an issue in terms of our ethical and moral responsibility, given how we like to champion ourselves, right?
Oh yeah, 100%.
Thank you so much. Thank you so much to you, Isaac and Meb. Thank you to my colleagues in the sector. You had great questions. You participated before we got on here, and you certainly remain active. Thank you for sharing your own information and thoughts with us. Let us know what other topic you want us to have Isaac and Meb come back and chat with you about. Maybe the next time the Canadian government decides to invest in our own vaccine. I'm seeing folks are identifying, I think, a group out of Quebec who's on the 3rd stage of a trial. I'm assuming that's a made in Canada vaccine, but I'm not sure. Thank you so much. You've both been so important.
I might just try to find like a different type of color.
Marsha, I believe you were muted really early.
Bring me your iPad because I don't know if it should be on break.
So thank you both. Have a great afternoon, everyone. Enjoy the rest of your week. Bye-bye. We will send you the recording on our
You
YouTube.
didn't plug it in.
And we will send you a link to the presentation. Thank you all.
Bye-bye.
Thank you very much.
Thank you, OCASI staff. Thank you, Amy, for organizing this.
Thank you.
Thank you, policy team, for supporting.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you. Bye-bye.
Be
Bye.
safe.
Bye, Amy.
Thank you.
That was Amy Ann. Yeah.
Thank you.
Bye, Tahani.
Thank you. Bye. Okay, bye, Debbie.
Bye, Yang.
Have a good day.
You too, Yang.
Thank you, Devi. It was a wonderful session. Thank you so much.
And thank you for letting us know when sound was working.
Yeah,
Appreciate
it was
that.
perfectly
Yeah.
working.
Yeah, I
Somebody has
appreciated
done.
that. Yeah.
Yeah, thanks.
Thank you, Debbie, so much.
Thank you, Nulam.